everyone, I'm Catherine Joyce Ruiz, Level 1 Student Nurse of Adventist University of the Philippines, and today I'll be performing a return demonstration of patient-nurse interview and the vital signs. So, as part of the pre-introductory phase, I'll be going to check the overall appearance of the patient and the body structure and also the behavior of the patient. And I also perform a proper hand hygiene before um, introducing myself and start the assessment. Okay, so good morning, sir. My name is Catherine Joyce Ruiz, and I'm a student nurse here. So I'm gonna assess your health concerns. I'm gonna be asking you a few questions and take your vital signs as well. Is that okay with you?
Okay.
Okay, so I may be taking notes during the process, but I assure you that everything will be confidential and will remain between you and me and our doctor, okay?
Okay.
Okay, so before we start, can you please state your name?
My name is Antonio Luis.
Okay, so Antonio Ruiz. And your age, sir?
50 years old.
Okay, 50 years old. Okay. So now I'd like to, before we start, do you have any concerns or questions? Like if you're not comfortable or something?
Nothing.
Okay. So I'd like to take your temperature, your blood pressure, your pulse rate, and for the vital signs just before the doctors come to see you. Is that okay with you?
Okay.
Okay. So I'd like to listen to your chest as well. Okay. Okay. I'm going to take your temperature first. Okay, so just stick this under your armpit, okay? Okay, press it forward. Okay, so it should be beeping in a minute. So I'll take your pulse rate before or waiting. You can have your other arm, sir. Just relax. Okay, I'll be taking your blood pressure as well. Okay. So I need your other arm. Oh, just right in time. Can I have first your temperature? 34. Okay. You just relax. Relax. Okay, so here's your vital signs. You have 76 beat per minute in pulse. Your breathing is 19, and your blood pressure is 13 over 100. 130 over 100. So I'm going to hear your chest. Okay. Okay. Breathe in. Breathe out. Again. Breathe out. Another one. And last. Okay. So I don't hear any breathing in your breath. So okay, for the next part of our patient interview, I'm gonna be asking you a few questions. Okay, now sir, I'm going to collect your biographical data. Is that okay with you? Okay,
Okay.
so what is your address, sir?
San Luis Boulevard, Barangay San Antonio, Luciana, Laguna.
Barangay San Antonio, Luciana, Laguna. What is your telephone number, sir?
577-9266.
And what is your birthday?
March 1, 1971.
And your marital status? Are you married or?
Married.
And what is your were you employed, sir?
No.
Okay. So I'm going to ask you more questions that concerns your health status. Okay. So what brings you here today, sir?
Sumasakit po ang aking bato.
Okay. So does it radiates in other part of your body? Does it radiates in your head or
All the head mo lang.
the head only? How about the other part of your body? Okay. So when did it start, sir? How long has it been going on?
Almost 1 year.
Almost 1 year. So is it occasional or
Personally,
continuous? You said occasional. When does it usually happen?
pagod.
Okay, so the pain you're experiencing, sir, how can you describe it? Is it dull? Is it sharp? Or is it knife-like? Paano experience? Ano yung nararamdaman mo sa pag nakaramdam ka ng sakit? Anong feeling? Paano may describe?
Parang tinutusok-tusok ang aking ulo.
Okay, in scaling 1 to 10, sir, as 1 as no pain at all, or 10 as unbearable pain, how will you rate it? Yung kung 1 to 10, yung 1.
Five.
So, let me just... Okay, so, do you notice, sir, what triggers that symptoms? Are you noticing anything that... yung kunyari ay meron ka bang ginagawa na naka-trigger ng symptoms, yung nasakit yung batok mo?
Pag napapagod.
Pag napapagod. Okay, what were you doing when it started? Ano yung ginagawa mo kapag naramdaman mo yung symptoms?
Take medicine.
Medicine. So you're taking medicine. What kind of medicine, sir, are you taking?
Pain reliever.
Wow, true time. So anything else that helps to relieve your symptoms? Just the pain reliever. Okay. So what makes it worse, sir? What activities that you think makes it worse? Ano yung nagpapalala ng symptoms?
Pagbubuhat.
What kind, ano yung binubuhat mo? And what kind of, what are you lifting?
Water.
Water. Okay. just to for it may help to treat your symptoms. Okay, for the past medical history, what illnesses have you gone through during your childhood? Can you remember any illnesses you have during your childhood? Meron ka bang mga sakit ng bata ka? None. So how about illness recently? Aside from this, yung mga naranasan mo dito lang, maliban dito.
Sakit lang ng katawan.
Okay, so have you gone and
Sa zero. Pero, wala.
okay. When was your last hospitalization, sir?
Sabi na, kumpay. Check up lang.
Okay, when is that, sir? Kailan?
Last month.
Okay, last month. Okay, any... Last month. Check up. Any injuries, sir? Trauma, like accidentally hit your head or...
Nothing.
Okay, so... about allergies, sir, do you have any kinds of allergies that you know you have?
Wala.
Okay. So, do you have any aside from the pain relievers, sir, that you're taking, do you have any over-the-counter medications like herbal medicines or
No.
you didn't take any garlic or
Garlic. Only garlic.
garlic? So, what are you doing with that garlic, sir? Are you eating that raw or boiling it?
Boiling.
Mm. Does it help your
Yeah.
relieve your
Yeah.
symptoms? Okay. Anything else? Meron pa? Okay. How about vitamins, sir? Are you taking any vitamins?
Minsan.
Okay. What kind of vitamins is that, sir?
Vitamin.
B complex.
No, B-complex.
Okay. Vitamin B complex. Okay. When are you usually taking that B complex, sir? So, kailan ka nag-take ng B complex? Once a day?
Once a day.
Every morning?
Every
afternoon?
morning.
Every morning. Is it constant? Regular? Every morning you're taking it?
Regular.
Every morning. So, since when, sir, are you taking vitamin B complex? Yung kailan ka pa? 1 year now?
Almost 1 year now.
Okay, 1 year now. Okay, does it help you with your symptoms?
Oh, yes.
So, for family history, based on your awareness, can you identify some illnesses that are present in your family, your parents, or your grandparents? Meron ka bang mga alam na sakit ng magulang mo?
Diabetes. High blood.
And my mom died. Who has diabetes? Sino may diabetes? Hypertension in your mother's side as well or father's side?
Mother's side.
Mother's side. No. Your grandparents have hypertension? Yes.
Yes.
Also diabetes. Okay. How about stroke
Or
or cancer?
she died.
Because of diabetes or they all died because of what?
Because high blood.
Okay. Okay, so are you noticing some symptoms? Okay. So next is lifestyle and nutritional. Do you use alcohol beverages?
No.
Or illicit drugs?
No.
Do you like drinking coffee or?
Yes, coffee.
Okay, so how much coffee do you take or how often do you take coffee?
Every morning.
Every morning. Do you prefer strong coffee or mild or?
Mild.
Mild coffee. Yes or no? Okay, so on your diet, sir, do you eat 3 times a day? Do you complete the 3 meals per day? Nakakompleto mo ba ng 3 times a day yung pagkain?
Yes.
Are you cooking your own food or are you buying food from the food court?
Cooking.
Your own food. Okay, so how heavy or how light do you eat every meal? How many cups of rice do you eat every meal?
2 cup.
Do you exercise daily? Do you at least walk under the sun every morning? You stay at home. Okay. So for the last part, sir, I'm going to ask you a lot of questions again, but about common health problems. If you have any of these symptoms, just say yes, and I will ask you more about it, okay? For first question, do you sleep regularly, sir? At least 8 or 6 to 8 hours
No.
every night? No. Bakit no? How many hours do you sleep, sir, every night?
6 hours.
Have you experienced sudden weight changes, sir? Yung biglang payat, biglang pagtaba, biglang pagbigat at biglang pagbagaan? No. Okay, so do you feel any fatigue or fever, chills?
No.
Do you have any recent changes in your skin, your hair, or your nails?
No.
You're not experiencing any changes in colors?
No.
Okay. So, do you have any vision issues, sir? Okay. Any blurriness?
No.
Double vision, blind spots? Okay. Pain in eyes that might tragic.
Oh, no. No.
Do you have a clear hearing aid, sir?
Yeah.
In
No.
both ears? Can you hear any ringing in ears? Sometimes.
No.
Okay. Ear pain?
No.
Do you have a runny nose recently? Tuloy-tuloy uho.
What? No.
Dryness of your nose?
No.
Tuyo yung any bleeding?
No.
Sinus pain? Okay, none. So, in mouth, do you have any issues in teeth or gums? In your chest, do you have cough recently?
No.
Obo. Chest pain?
Sometimes.
How often is that sometimes? Do you feel it whenever you perform a heavy activity? Yung naggawa ka ng mabigat na trabaho? Or
Naglalakad daw malayo.
okay. When you experience that chest pain, do you also experience your pain in your
No.
breathing difficulties?
No.
Okay. Do you have palpitation, yung
No.
abdominal pain?
No.
Not wanting to eat, yung bigla ka mawawala ng gana kumain? Constipation? Any changes in bowel?
No.
Okay. Notice any changes in volume or frequency in urine? Yung pag-ihi mo, biglang nawala. Okay. Changes in color?
No.
Difficulties in discharge? Yung
No.
mahirap ilabas? Okay. In musculoskeletal, muscle pain? May muscle pain ka ba? Yung sakit mo?
No.
Backache?
No.
Joint pain or namanas?
No.
Swelling? Okay, hematology. Do you notice any sudden appearance of bruises? Yung nagkakaroon ka naman ng pasa? Bleeding gums?
No.
Okay. Leg cramps?
No.
Tapos excessive sweating? Yung pawisang ka lagi. Okay, so any sudden nervousness? Hindi lang kinabahan. Are you feeling anxious most of the time?
No.
Any hallucinations or emotional distress?
No.
Okay. Anything you would like to add or share? Okay. So I've got your vital signs, sir. The doctor is gonna be coming in next. I'm just gonna give her the results and what I have just done, and she'll come and visit you, and I'll probably see you after that. So, gonna take this result to the doctor and just record it.
Okay, thank you.